Hey everyone, I'm Natalie Bencivenga. Welcome to a very special bonus 5 minutes with. I am so excited to chat with two wonderful women from the Basic Health International Organization based here in Bakery Square. I'm chatting with Dr. Miriam Cremer. She is the founder and the president of BHI, and Kate Colligan, who handles their development and communications. Thank you so much for joining me.
Thanks for having us.
Thank you.
I'm really excited to have you both here with me. So for people that may not know, Dr. Cremer, can you explain a little bit about how BHI began and what is it? What's its focus?
Sure. So BHI is an organization that is working towards elimination of cervical cancer. And it started from an experience I had as a medical student. Over 20 years ago, I worked in a rural area as a rotation as a fourth year medical student. And I worked in a small village with no electricity, no running water, and worked with a healthcare promoter who was the only health provider in that community. And we went one day to visit a young woman with children who was dying of cervical cancer. And eventually she bled to death from this preventable disease. And it inspired me to try to spend my life career really trying to make sure that no one dies of a preventable disease.
That's incredible. So you are an OBGYN and now your focus is really on BHI and the prevention of cervical cancer. Can you explain a little bit about how the impact is here in the United States with people getting cervical cancer as it is across the rest of the world?
Yeah, of course. So cervical cancer is a disease that affects women who don't have access and who are poor. So 90% of cervical cancer occurs in low and middle income countries. However, cervical cancer affects our poorest women, our people of color, minority women. So it hits right here at home as well.
And can we talk a little bit about during COVID, how did your organization address the needs of our communities during the pandemic, and how did you have to pivot during that time?
Yeah, I mean, I think we all had to pivot. It was a really complicated time. So we have been working really hard with engineers that create tools that are usable in low resource areas. And so I will say we continued to work with those engineers. And one of our pivots was that we helped an engineer develop COVID testing. And the basis of that COVID testing can be used for testing for HPV, which causes cervical cancer. So we were able to build some infrastructure that will be able to be used later. So that's really exciting.
I always find that fascinating. Out of something terrible, something amazing can blossom. And when we're talking about HPV, I think a lot of times we think that this is an issue that people with cervixes or with uteruses or the female reproductive system deal with, but men can also get HPV and it can affect their health as well. Can you sort of link in why we should all care about this as all people?
So certainly, I think there's a lot of reasons why we should all care. For the cervix part, everybody has, somebody they love with the cervix who could be susceptible. But HPV affects both men and women. Men can get genital warts, men can get oral cancer or rectal cancer. So HPV causes cancer in humans.
So when we're talking about ways to prevent this disease, this cancer, what can people do?
Yeah, I mean, the great thing is that it's preventable, and we have, we know what causes it, which is rare in medicine in general. We know the virus that causes it. Although I want to make sure that everybody knows that not everybody with HPV will wind up with cancer.
Right.
So sometimes it's cleared and we don't know quite who will go on to lead it. But you can prevent getting HPV by getting vaccinated. The vaccine is indicated for both men and women. So girls and boys can get vaccinated as young as age 9.
Wow.
and vaccination is wonderful for preventing cancer. And for women, making sure that getting screened and treated for cervical precancer is another way to prevent problems.
So you're really trying to put yourself out of a job here, is what I'm hearing.
Yeah, that would be ideal. I would love
That
that.
would be ideal, right? So let's
Yeah.
pivot a little bit. So in order to help put Dr. Cremer out of a job, we're trying to get as much awareness built around this cause as possible. So Kate, can you talk a little bit about what's going on this Father's Day and how men and fathers in particular can help support their daughters?
Yes, and thanks for giving us this moment to say something about it. We decided that Father's Day could be used in so many different ways, but we see a real correlation between girls' health, women's health, and men. And so, how can we involve men more in a topic that they may not usually stand up for, but they're really involved. They now, as Miriam mentioned, they know and care about somebody with a cervix somewhere. And probably they were born from that cervix. But we should hope that we've started something called Dads for Daughters. So if you look up hashtag Dads for Daughters, and it's geared towards let's get some men in our community involved in standing up for women's health. And what we've made it very simple. We're just asking you to sign up at our website there at www.basichealth.org. There's a pop-up. You can make a donation, and we look forward to following up with you. We're planning to do more Dads for Daughters events in the future, but this one's special because this is our lead event, and our kickoff is Father's Day. So we would like each father who's able to give a donation or to spread the word to text or email or social media or whatever is best for you for other dads, because it's Dads for Daughters. So you don't have to be a dad. You could be a daughter doing this for your dad. You could be anyone who cares about this and wants to amplify it on this specific day of Father's Day.
I think that's so wonderful. And as we wrap up this 5 minutes with Dr. Cremer, where do you see the trajectory of Basic Health International going as we move forward post-COVID? What is your dream for the organization?
Yeah, my dream is that we continue to eliminate cervical cancer. So, part of the pandemic is that some of our preventive health systems have really slowed or come to a halt. So I want to make sure that we do catch-ups on screenings and vaccinations. And I want to grow our model. Like, this is amazing because it's a disease that really can be prevented. And I will spend the rest of my career, and hopefully not, so help put me out of business, working to eliminate cervical cancer.
I think it's a wonderful mission and an important cause. I wish you the best with the organization. Thank you so much for allowing me the opportunity to help spread the word. And thank you both for spending just a little bit more than 5 minutes with me.
Thanks for having us.
Thank you.